Our first guest today is Dr. George Bell of Novant Health Family and Internal Medicine, South Brunswick. Well, welcome to the show today, Dr. Bell. It's such a pleasure to see you again.
I'm delighted to be here. Thank you for having me.
Oh, sure. You're quite welcome. Now, I know that we were at your practice not long ago and did the whole show from there, and folks got to have a tour of the facility and what have you. So today I want to get to know you a little better as well as your partner. And so let's start with learning about your background and your education. Tell me about that.
Oh, how many hours would you like?
No, just hit the highlights.
Okay. Well, I was educated in Illinois. We lived in northern Illinois on the Illinois side of the Wisconsin state line.
Okay.
And actually, the University of Wisconsin was closer to go to college, but because I was living in Illinois, it was cheaper to go to Illinois.
Oh, absolutely.
So I was educated at the University of Illinois, and then got on the bus with the classmates of mine and drove up to Chicago and went to medical school in Chicago. During medical school, I received a call from the Navy, and they offered me a scholarship to go through medical school, so I accepted that.
Oh, fabulous, yeah.
And I was sworn in as an ensign. So I was an ensign in the Navy through medical school, but I have to admit I never wore a uniform.
That's okay.
And then when medical school finished, I was, if you're on a military scholarship, when you go through medical school, you are offered a military internship. So I was really unlucky, and I got San Diego for my internship. So I did a year of internship at the Naval Hospital in San Diego. It was a brand new hospital that year. It used to be the Pink Palace, and then they had built a brand new facility, and I was the first intern class to go through that facility. It was just gorgeous.
Oh, that's great, yeah.
And did really well serving the naval personnel there.
Sure.
After that, with a military internship, then you have a choice. After that, you can actually go out into the military and serve as a medical officer, or you can go on and do the rest of your training and then go in the military as a specialist. Well, I chose to go into the military at that point and got assigned to the Marines. And I remember wearing a naval uniform, walking into the Marine Corps commanding officer's office the first day that I reported for duty at Camp Pendleton. It was there.
Yeah.
And he looked at me and he said, "I know that your uniform says Navy on it, but you're a Marine now." So I got assigned to Marine Corps Infantry as what they call a battalion surgeon, and I had corpsmen that worked under me. I was their supervisor, and they worked out with the squads of Marines. Well, during that time, the Marines travel a lot, so I got to the Philippine Islands, I got to Okinawa, Japan, and Desert Storm started.
Oh, that's when Desert Storm,
That was the first, sort of the first war in the Middle East that we were involved in with, I think, with Saddam Hussein.
Right.
And so I actually ended up going through Desert Storm.
Wow, that's
with
interesting.
with the Marines.
Wow.
And it was a very interesting experience, to say the least.
Yeah. Well, most recently, where did you practice medicine?
Okay, after I finished with the Marines, I finished my training in the UCLA system in Los Angeles, and so I was out west. And when I finished training, I had become familiar with the state of Idaho, and I found a town in northern Idaho that really needed internal medicine. So I set up my practice there as a private practice, right across the street from a hospital, and I was there for about 10 years. In the meantime, my parents were getting a little bit older, and they were back here on the East Coast, and they had retired to South Carolina, to the upstates on a golf course. So as they got a little older, I realized that I needed to come back east.
Sure.
And so I took a position in Charlotte and was there for about 10 years. And my wife and I grew accustomed to the coast, and we really
Sure.
fell in love with it. And so when this position opened up with
Great.
Novant, I interviewed and thankfully got the position.
That's great. Well, I understand that you're board certified in internal medicine, and for our viewers who might not be familiar with that, tell us a little bit about what that means.
Okay. Board certification is available to most specialties. In internal medicine, it means that you have gone through an accredited internal medicine training program, which I did it in the UCLA system. And then at the end of that, you take an examination, and if you pass the examination, you become board certified.
Right.
And then you recertify every 10 years and retake an examination, so it keeps you current and up to date on things. They're about ready to change that. I think the American Board of Internal Medicine is about ready, I think, to sort of start doing a yearly thing where you just sort of, over a course of 10 years, recertify gradually.
With internal medicine, what would be the youngest patient that you might see in your particular practice?
Oh, great question. I get that question all the time. Internal medicine is mainly for medicine for adults, so we get about 18, age 18 and above. Occasionally we'll see a 17-year-old, but that's sort of pushing it.
Well, that's great information, and I know that your partners are family practice, and so we're going to talk to them in just a few minutes, and I know that they'll start seeing patients much earlier because they are family medicine.
Yes, they'll do some pediatrics and maybe even some newborn care.
Great. We'll let them tell us all about that then.
Great.
Well, thank you so much for being on our show today, Dr. Bell.
Oh, you're very
time
welcome.
goes so quickly, and you have such an interesting background. I'd really love to hear more about it. So maybe after a few years or a year or so, maybe we'll have you back on the show, and then you can tell us what's going on.
You bet. Maybe I can come tell my war stories.
That'd be great.
And
I
put
would love
everybody
that.
to sleep.
That'd be great. No. Well, thank you again. It's been a pleasure.
Oh, thank you for having me.
You're welcome.